Good day, my name is MJ van Jaarsveld, and today I will be presenting an audit on the cost and environmental implications of intravenous versus oral paracetamol at Cork University Hospital. So background, paracetamol is a vital part of multimodal perioperative analgesia. Intravenous paracetamol is frequently used intraoperatively, but it's more expensive than oral paracetamol and is supplied in a glass bottle, creating additional environmental waste. In many patients, elective surgical patients, the oral route is immediately available before anesthesia. So the aim of the study was to quantify intraoperative paracetamol use where the oral administration was available preoperatively, and also to estimate the potential cost savings and environmental benefit from switching suitable patients to oral paracetamol. The methods, so it's a prospective audit in CUH theatres 1 to 8 over 2 weeks. A daily audit tool was completed by theatre NCHDs, recording contraindications to oral paracetamol, preoperative paracetamol use, and intraoperative IV paracetamol use. So with the results, on the left bar graph, we can see that 180 patients were included in the study. Of those, 121 did not receive any preoperative paracetamol. 29 of the patients received oral paracetamol, and 34 received IV paracetamol preoperatively. It should be noted that the patients that received preoperative paracetamol were oral ward patients that were charted for routine paracetamol. The pie chart in the middle shows intraoperative paracetamol use. So 160 patients received IV paracetamol intraoperatively, and 24 patients weren't given any paracetamol. Then the table on the right-hand side shows the cost and environmental impact. So we annualized the paracetamol use. So we took 160 doses, times it by 52, and we estimated that we use 4,160 doses per year. There is then a cost difference that we found in collaboration with the pharmacy of €1.50 between the IV and the oral solutions. So this represents an estimated cost excess of €6,240 per year, with an annual estimated excess cost range of 5,800 to 6,500 based on the confidence interval. And then lastly, switching suitable patients to oral paracetamol could avoid 4,160 glass bottles annually. So then with the discussion, so IV paracetamol use was common, with 87% of patients receiving it intraoperatively. Of those, only 4 had a documented contraindication to oral paracetamol, suggesting most patients may have been suitable for the oral route. A cultural shift is needed from routine intraoperative IV use towards earlier preoperative oral prescribing and administration. This would, however, create additional workfall on ward staff and day surgical nurses, so intervention should be practical and protocolized and developed with nursing input. So the estimated annual excess cost was $6,240 for this single drug alone, with additional glass bottle and packaging waste. The limitations of the study included that it was a short audit period, and that works on the assumption that it reflects usual theatre activity, and it might possibly have missed eligible patients. Suggested intervention would be routine preoperative oral prescribing for suitable patients, supported by protocols, education, and anesthetic chart prompts. Thank you so much.